Hi, Dr. Michael, Key West Spine and Injury, Key West's largest auto injury rehab clinic. Here today with our next coronavirus update. Tonight I want to talk to you about best outcomes. We're in the middle of a worldwide pandemic. Best outcomes sounds like a relevant, important topic, doesn't it? Before we jump into that, I do want to tell you that we are open. So we continue to follow all of our strict precautions. And I do have to confess, I think part of the reason we've been so successful is we cheated. And let me explain. Right from the beginning, I saw that the first thing in the news they were talking about this COVID-19 was really dangerous and really susceptible were the elderly, and particularly elderly with underlying health conditions. And so the cheat was, I went to the local old folks home, which is probably not politically correct, the local elderly living facility, rehab facility. And so what I did is I stole their precautions and everything, all their protocols, what they were doing. So right off the bat, right from the get-go, we were taking everyone's temperatures. We were providing masks. So we actually had them custom made. And so we had masks, we had the temperature. We were doing everything we could, asking questions, screening everyone. So I think that's a lot of that cheat that we did in the beginning. It was a good cheat, but I think that cheat we did right from the beginning is what allowed us to avoid any problems, and we continue to stay open. So with that, let's jump into the topic. I want to talk about best outcomes. We hear over and over from the local professionals. I particularly like Dr. Burrows and Dr. Norris's videos. If you're not watching theirs, go watch them. They're awesome. I watch every single one of them. They're great. They keep talking over and over about testing. We need more testing. Well, what is that all about? I'm no infectious disease expert, but I think I can break this down pretty simple for us, guys. When we have an early diagnosis, which you got to have tests, obviously. So the more tests we have, you got an early diagnosis. The earlier the diagnosis, the earlier the intervention, the better the outcome. So that's what I'm going to talk about today, about this best outcomes idea. It all starts with this, and all across healthcare, this early detection or early diagnosis. The earlier the intervention, the better the outcome. Let's talk about COVID-19 alone and needing to get tests for that early diagnosis. How about some of the regular killers in our country, the big killers? Cancer. Do you want to find out you've got cancer when you have stage 4 cancer, or do you want to find out when you've got stage 1 cancer? Again, I don't think we need to consult with an oncologist. I think that's pretty obvious. The earlier the diagnosis, the better the outcome, the better the intervention. The earlier the intervention, the better the outcome. So the same, let's take cardiology. Dr. Burrows, of course, one of our favorite guys, make the videos. His background is in cardiology. I think he'd confirm with us. Do you want to find out you've got heart disease when you're clutching your chest and falling to the floor with a heart attack, or do you want to find out that you have that heart disease years or maybe even decades prior? That earlier the diagnosis, the earlier the intervention, which is a good point here. Notice I said earlier diagnosis, earlier intervention. That intervention may not even be medication. You may not need stents in your heart. The earlier the intervention, the earlier the diagnosis, that intervention, if it's so early, it could be, lose weight, diet, exercise. And so again, the earlier the diagnosis, the earlier the interventions, the better the interventions. The later it is, the more extreme. You got open heart surgery, in this example. So the point is, the earlier the diagnosis, the earlier the intervention, the better the outcomes. Well, guess what? It's no different in my field as well. And so again, I'm no expert in infectious disease, but I do know what we do. We do car crashes, auto injuries, traumas to the spine. So the biggest diagnosis that we can affect the intervention and the outcome is the ligament damage. And that's really the core damage that we see in car crashes, bicycle crashes, that kind of stuff. And so I know everyone, like I keep talking about, I love their videos. Dr. Burrows and Dr. Norris, they've got these IgGs and IgMs. They got all these cool graphs that they're showing. So what I want to do tonight is I want to show some cool graphs of us. All right, so we got some cool graphs too. So let's jump into this. So here we go. So I'm going to bring this in real close so you get a real good view here, all the way in. So this is lateral, cervical. Lateral means from the side. Cervical is the neck. So these are two views. You've got flexion, where you're looking down at the ground, and then this one, extension, where you're looking up at the ceiling. So these two views, what we did then, I went and then digitized. So every single one of these points is very time-consuming, very meticulous, very precise work. But what this does, it allows then the computer to analyze this after this digitation is done. So every single one of these points can be altered by magnification, by inversion. Maybe you can invert from white to black and black to white to help you get a precise point. And then of course you've got contrast and brightness. So all four of those parameters can be altered in every single point. So again, it's just, the point is very time consuming. Once that's done, it allows us then to see two factors that we're going to note, that we're going to look at with this ligament damage. And that is the biggest, again, problem with these whiplash injuries, spinal traumas. And so the first one you're going to see is called angular deviation. So let's walk. So this is somebody, again, looking down at the ground, flexion. This is somebody looking up at the ceiling, extension. And so that's globally flexion, that's globally extension. But intersegmentally, I mean, each segment, then you can measure, of course the computer does this, once I've plotted all those points, it's going to get a flexion angle and an extension angle. So each single segment is going to be measured, the flexion and extension. So let's go down and we'll see that. And so this is first in a chart. So here's this person's chart. This is an actual patient. And so you've got every one of the segments. You've got the flexion angle, the extension angle, and then what's called segmental angular deviation. The deviation, the difference between the flexion extension at each angle, at each segment, sorry. So the next thing is, once we have that established, you know the difference between those angles, then you look at the difference between each segment. So it sounds kind of confusing, but it's basically the difference of the difference. It's kind of poor English, but that's the best explanation. And so there is a normal range. There's a normal amount that the ligaments are allowed to stretch and move. Does that make sense? So there's a healthy spine, obviously, normally. And so now let's move down to the bar graph. And so this patient, you can see the 7 millimeters is considered normal. So there's the 7. And this patient actually has 3 of them that are beyond normal. They've stretched. So this is ligament damage that's been done to this patient from their whiplash. The red line out here, and if you can see the real small, says 25%. What that means, that's a 25% automatic impairment rate. You don't have to apportion these from an impairment standpoint. This is AMA guides. This is from the AMA guides from impairment. So this is, like I said, not a chiropractic test. This is the state of the art right now, the most current scientific way of measuring damage to your ligaments. And so this one's a little more easier to understand. So you got angular deviation, 1. Number 2 is translation. Translation is a little simpler. That's just slipping. So if the bones, when you move up and down, when you flex and extend up and down, obviously the bones should continue to line up. If they start to slip, that's again because damaged ligament. The ligaments are ligament lax. These are the term. They're lax. They're stretched. And so that stretching is going to allow the bones to slip, or to translate. And so let's take a look at that. Here is the chart. And so you've got each segment, you've got the amount of translation or slippage, and then of course the max range in the cervical region is 3.5. It varies by region of the spine. We're looking at the cervical, the neck. So this region is 3.5 millimeters. So let's go down to the bar graph, and you see up a little too far. So the bar graph shows, again, 3.5 is out here. That's the 25% automatic impairment, but the actual normal range is only 0.6 millimeters. And so in this person, basically 5 out of 6 segments were abnormal. So there was stretching in all of these segments. There was too much slipping of those ligaments. And so, and one of them, of course, hit the red line. So unfortunately, that means an automatic 25% impairment according to the guides. And so, again, I want to kind of back this up again. Those are some really cool tests that we do. Again, not to brag, but we're the only people in not just Key West, but the whole Florida Keys that have this type of testing. So this is our special. This is what we do. So I would kind of joke, I want to show you some cool graphs like Dr. Burrows and Dr. Norris are doing. We got cool graphs too. In all seriousness, maybe not as important, not life or death, but no doubt this is what we do. So, and that's really what we're doing here today, is we want to make sure that everyone knows to help. Our job is to take the burden of this serious COVID-19 crisis as they're fighting the real fight. We're here to take the burden. So if you've been in a car crash, a scooter, bicycle injury, let's take care of you and let them do it. The emergency department, the urgent care centers, let them do the real important stuff right now, and let us do the job that we do. So any questions, by all means, like I said, as always, leave a question for us. We're happy to answer that. Other than that, everyone take care. And any questions, you always call our office, 305-453-6610. If not, everybody have a good night, and we'll talk to you again soon. Dr. Michael, Key West Spine and Injury, Key West's largest auto injury rehab clinic. Take care.